Hello. My name's Barry. I'm just an average young guy, 26 at the time, 27 now. Let's see, moved to New York from Texas, left all friends, family behind, wanted to start something new, come out here and do PR. Did it for 4 years, had great health coverage, no problems. Went to the doctor a week before I quit that career to try to start a real estate career. And they found, to go for my update because I had a heart murmur, to which I was told that it'd be, if there was surgery, it'd probably be in my 60s or 70s or something along that. So it's not really that big of an issue for me at the time until I started real estate, and a week into it, I get this phone call from my doctor that says, things have changed, you need to have your surgery, open heart surgery at the age of 26. When I had it, I was the youngest person on my floor. Just something that a 26-year-old living in New York that saved money to come here to try to do his thing, doesn't really expect on, coming to terms with, I guess, at the time. So I went down to Texas. Well, first of all, I got on my Cobra, which the bills were about $400 a month, which is a problem because living in New York, great city, high rents, as we all know, but great city nonetheless. So every month I start out with a negative $400 balance in my checking account to pay for my insurance, to pay for the co-pays on my pills that cost about $20 a bottle, 10 different bottles. It tends to add up, $6,000, $7,000 a year that maybe I could be saving for something like a house or something along those lines. I exhausted efforts in trying to find health insurance. I tried to get a partnership with my girlfriend. They won't take opposite-sex partnerships at her work, which is fine, I guess. I love my girlfriend. I'm not going to marry her for insurance. It's not happening. I have too much money in my bank account for Medicaid, but not enough money in my bank account to pay the monthly payments. So it's kind of a weird situation I'm in with that. I called numerous insurance. I did my research on it. Each of them said $800 to $1,200 a month for coverage. Pre-existing conditions is a whole other thing. Here's the thing, people stress out about so many little things, but nobody has stress like someone without insurance during something. I can't tell you enough about sleepless nights. Friends, family, they've all been great, but they don't want to talk about insurance all day. It happens. For living in such a great city like New York, and a great country like the United States, I think that there has got to be a simpler way for me to get insurance without paying $500 a month. I don't know. It just does not make sense to me. It doesn't make sense. And my story's not even a bad one. You're going to hear stuff that is so much worse than my heart surgery at 26, and that's fine because I'm healthy and it's good. It's great. But at the same time, $6,000, $7,000 a year just to be healthy, just to live here before I start spending money, that's freebie. That's tip on a check. But I guess that's pretty much my story. That's my thing. If there was some other option for me, I'd love to have it. If one of you has another option, just let me know about it. I'll look into it. I'll check it out. I don't know. That's pretty much it. Oh, and my Cobra payments just went up to $470 a month from $400. So thank you, Cobra. Cheers.
Good evening. My name is Lisa Beth McKinley. My story is this. I was very fortunate not to have any health problems from 1974, when I had my last full-time insurance coverage, until October of 2005. I was very fortunate because my genes are very good, but 2 months after I heard and signed up for a wonderful coverage that is partially supported by Medicare, Now it has a lot of names, and I'll have to read them off because I can't remember all of them. AARP, Medicare Complete from Secure Horizons, I got it literally 2 months before I was diagnosed with breast cancer. Now, there were complications. I had a lumpectomy, a mastectomy, for which I had to pay a hospital deductible of $1,500. But I didn't just have those 2 procedures. I had reconstructive surgery, and at my 4th procedure, I caught a staph infection in the OR, which set back my reconstructions of the breast and had to begin all over again. So all in all, I have had 8 procedures in a little over a year and a half. The first year, the coverage was wonderful, except for the very costly deduction and because I was in the hospital 8 times. Luckily, those 2 years, the first deduction was $1,500, the next year was $1,750. Now the deduction is $2,000. Hopefully, I will never have to go into the hospital for surgery again. But last July, a little over a year ago, my cancer metastasized. And for the first time, I agreed to go to an oncologist, which I had not done before, which was a very good thing that I didn't have traditional chemotherapy after my mastectomy, because with the staph infection coming so shortly afterwards, I probably would have died from the staph infection because I would not have had an immune system. Well, when the cancer metastasized, I went to an oncologist. They discovered that the comparison of tissue samples was that I had exactly the same type of cancer, which is now treatable, not through traditional chemotherapy, but through a wonderful drug which is very specific to that cancer. Well, I'm now having to have PET scans twice a year. And in 2008, when I had the first PET scan, and they determined just exactly where the cancer was when it metastasized, when I had the follow-up PET scan in February 19th of 2009, I hadn't really been informed by my health care people that I was now going to be liable for paying 20% of all x-rays. Yes, 20% of $5,000 is a lot of money, and I'm retired pretty much, and I just do not have that kind of money. The February 19th PET scan was very good. The Arimidex had totally taken care of the cancer, but now I still have to have PET scans twice a year. And I cannot afford. So I explored, as did Barry, many different insurance companies to see if I could get an insurance carrier to pick up the 20% that I cannot afford to pay. And later I was told by my insurance carrier that if I got a secondary, I would be let out of the plan. So I'm literally between a rock and a hard place. And God forbid that things should turn around again. I don't think so, but I'm sure there are other people like I am who had initially good insurance coverage and now find themselves in a dilemma. How to pay for very expensive x-ray treatments. That's my story.